thanks very much. As I said, I'm going to follow on really in some ways from what Larissa's been talking about, but try and take it a step further, looking at the effect of active implementation of the CONSORT guidelines for reporting abstracts of randomized trials, looking at high-impact medical journals, and taking a slightly different approach by using an interrupted time series to follow up over time. This was a study done by myself, Philippe Raveau, Gabrielle Baron, and Isabelle Bertrand. I think we'd all agree that clear, transparent, and sufficiently detailed abstracts of journal articles for reporting randomized trials are important because readers base their initial assessment of a trial often on the content of the information reported in the abstract. And in some cases, health practitioners may only have access to the information in the abstract. And there are reported cases where decisions, healthcare decisions have been made purely on the basis of the information in the abstract. So the CONSORT for abstracts was published in January 2008, and it provides a list of essential items to include when reporting the main results of a randomized trial in a journal or conference abstracts. And I think we've got to recognize that journals have developed their own structure for reporting abstracts, and this extension to the CONSORT statement is not intended to suggest changes to these formats, but merely to recommend what information should be reported within them when describing randomized trials. And indeed, in October 2008, the ICMJE recommended that articles of clinical trials should contain abstracts that include the items that the CONSORT group has identified as essential. And in March 2010, the CONSORT statement was updated to CONSORT 2010, and indeed, it now gives specific guidance for reporting abstracts of randomized trials in journal abstracts. So the aim then of our study was to investigate the impact of the CONSORT for abstracts guidelines and of different editorial policies used in 5 leading medical journals to implement the guidelines on the quality of reporting of abstracts of randomized trials. So we randomly selected up to 60 primary reports of randomized trials per journal per year from the Annals of Internal Medicine, the BMJ, Lancet, JAMA, and the New England Journal of Medicine from 2006 to 2009, if it was indexed in PubMed and had an electronic abstract. And we classified the journals into 3 main categories. So we had journals not mentioning the CONSORT for abstracts guidelines in their instructions to authors, so that was JAMA and the New England. Then we had journals that referred to the CONSORT for abstracts guidelines in their instructions to authors, but they didn't have any specific policy to implement the guidelines within the journal, which was the BMJ. And then we had the third category was journals referring to the CONSORT for abstracts guidelines in their instructions to authors and with a specific policy to try and implement, and I do say try, these guidelines within their journal, and that was the Annals and the Lancet. So in our study, we had 2 main outcomes. Well, actually, the first was our main outcome measure, where we looked at the mean number of items reported in less than 50% of the abstracts across all 5 journals in 2006 at the beginning of our study. And we used a 0 to 9 scale, so we focused on the poorly reported. We also wanted to look at the very poorly reported items, so we looked at the mean number of items reported in less than 20% of abstracts across the 5 journals in 2006, and that was measured on a 0 to 5 scale. So this slide just shows you the 9 items that were reported in less than 50% of abstracts in 2006, and in the red I've just highlighted those which were very poorly reported, so reported in less than 20% of abstracts. And it's perhaps no surprise to see details of randomization and blinding in there, and also details about the number of participants who are actually included in the analysis. So overall, we assessed 955 reports of abstracts of randomized trials. And what this slide shows you are changes in the number of items reported before and after introduction of the CONSORT for Abstracts guidelines in 2008. And the vertical lines here indicates the transition phase where we deemed implementation of the guideline to have taken place, if indeed it was. So on the left, we report data for the items reported in less than 50% of abstracts in 2006. So that's focusing on the poorly reported items. And then on the right, we've got the items reported in less than 20% of abstracts at the beginning of the study. As you can see, really, there's very little difference pre and post introduction of the guidelines when we look at all of the journals together. This slide gives you data for the two journals, the Annals and the Lancet, which included the CONSORT for Abstracts guidelines in their instructions to authors and had some loose-term sort of active implementation policy. And this could be simply asking the authors to comply with the guidance when they revised their manuscript. But in some cases, changes were actually made in-house at these journals by the editorial staff. And as you can see, there's a significant improvement in the number of items reported following the introduction of the guidelines. And I think it's particularly apparent in those items which were previously very poorly reported. So on this slide, we've got data for the journal which included the CONSORT for Abstracts in their instructions to authors, but didn't actually have any in-house policy to try and implement the guidelines. And sadly, we see really very little difference pre and post introduction of the guidelines by just including it in the journal's instructions to authors. And finally, this is the two journals, so the JAMA and the New England, which didn't actually mention the CONSORT for Abstracts guidelines in their instructions to authors. And perhaps not surprisingly, it hasn't made any difference. I think our study does have some limitations. Firstly, we only included randomized trials published in high-impact journals, and I think we've got to recognise that the resources and the procedures available for these journals are not the same for all journals. And also that the overall quality of reporting in these 5 journals might be higher than other journals. And it's certainly something, when we've looked at the main CONSORT statement, that we've noticed. And also, we decided to focus purely on the poorly reported items, and assuming each of those items that I showed you on that list were equally important. And that may well not always be the case, depending on the perspective of the reader. But we hope that by focusing on those items which were poorly reported, we hope to see the greatest improvement in the impact of the guidelines. So, in conclusion then, our results show that the CONSORT for Abstracts guidelines improved reporting only when it was implemented by a specific editorial policy. And as I said, that could have been an email sent to the authors when they revised their abstract saying, we want you to comply with the guidelines. And as I say, in some instances, changes are being made by assistant editors at those journals. And I think our studies, the results of our study is consistent with systematic reviews of clinical practice guidelines, if we take that analogy, which basically shows that passive dissemination of a guideline is generally ineffective. And if we're going to try and implement guidelines, whether they be clinical guidelines or reporting guidelines, we need specific strategies to try and implement these research-based recommendations if we actually want to try and change practice. So I'd just like to end by acknowledging the editors that actually spoke to me and provided some insight into their editorial practices. I'm very grateful for that. And also, we have recently published the full study, so if you're interested, you can have a look there for more information. Thanks very much.